I've already always had bad teeth, so I had a lot of decay from a young age. And then I was at a home from a young age too, so I didn't have any money to fix them. So I met my partner and we got engaged, and I knew I had to wanted to get them fixed for my wedding, so I went to a dentist, and he started ripping them all out, and we got to a point and he was going to cap the front ones, and I asked him that, we've got this big gap at the back, I need to do something, and we were talking about implants. He did a bone scan and said it wasn't an option for me because I didn't have enough bone. So he put a denture with the caps over a tooth, and as soon as he put it on, there was so much pressure. Within a couple of months, one had already popped the whole tooth. He took x-rays and said it was all the teeth all in the front, and there was nothing he could do. And so I never went back because I'd spent so much money trying to fix them already, and then I was losing them straight away. So obviously I have a bit of a phobia about coming here, but I'm also really embarrassed about it as well.
Megan.
Hello.
Here we are. So how are you feeling?
Good. Yeah. A little nervous. Yeah.
Yeah. Oh, he's nervous too. But,
yeah.
That's a natural thing.
So, how have you been feeling since you've got this? Since you got your teeth done?
Amazing.
How's your life changed?
Oh, completely changed. A lot. I have more time on my hands. I'm happier. The anxious feeling has gone now. My studies, I'm acing my tests because I have so much time to study, and I'm retaining information because I'm not thinking about my teeth anymore. I'm actually, can concentrate on what I'm doing at the time. So, it's fabulous. People notice that I'm happier now.
Yeah.
Notice my smile.
You look amazing, so.
Thank you. I'm, still, I guess, getting used to the attention of having a nice smile because I've been hiding my smile for so long. So I'm getting used to it, but it's nice. And I'm feeling good about myself now. Yeah.
It's fantastic. And the kids, how do they feel about when they first saw it? The
amazed.
9-year-old.
They were amazed and just so impressed, and they could just see a new me straight away, which is it was nice.
You've got a 17-year-old and a
9-year-old.
9-year-old.
Yeah, so straight away white smile, big smile from mum, and I was happy, so I'm smiling all the time now. I guess I get to spend more time with them now too, so they're loving that. Yeah.
Did they know you were having something done with your teeth?
Yes, we're a very close family. So as time progressed and it was sort of on my mind more, it took me away from the boys a lot, and I was spending more time sort of trying to fix myself up to make myself presentable when I went out of the house. Yeah. So they definitely noticed my time away from them, and they missed that too because, as I said, we're a very close-knit family. We love spending time together and having family outings and occasions. So yes, definitely they were noticing it a lot towards the end, and that's obviously when I made a decision I can't live like this anymore. Then I needed to fix the problem, yeah.
Megan, when you first came to the clinic and we had our first consultation, obviously you were quite nervous and it was quite an emotional appointment. How did you feel when you sort of walked away from that appointment, that there was some hope?
Yeah, I was really obviously drained emotionally, but yeah, absolutely stunning to know that I'll get my life back and I'm not spending hours every day trying to make myself presentable for work, or my kids are missing out on me at the moment a lot, and my family, so yeah, I'm looking forward to getting my life back.
I know you told me the time it takes you, how long every morning to get
hours. I'm up at 4 o'clock and
to get your teeth ready.
Yeah, just to get myself ready because I'm in and out of meetings. So, and currently, I will eat breakfast and having something really big to eat before I go, and then I won't eat usually until I get home in the afternoon because I don't want to risk teeth coming out.
I know it's something you don't want to talk too much about, but what was involved every morning in terms of the process?
Yeah, so I looked online and got some composite. And yeah, I've just been putting a composite to support the behind the front teeth. And yeah, the eye teeth, they're just sitting in there. So
in the sockets, I know.
Yeah, and obviously overnight it starts healing, so you've got to. It hurts to put them back in the morning.
So you take them out every night?
Yeah, I don't want to swallow them. Yeah, but I said I didn't want to, book her in the teeth.
Every day you do this?
Yeah.
Every day? Wow.
Yeah.
I want to see it. Do you mind to show me?
Yeah.
Show me.
Once it's out, it's out. Though.
Once it's out,
Yeah.
we're going straight into
we have to take it out.
Yeah, so just glue the composite.
Okay.
You got some tissue too. Just put that on the tongue.
Yeah, no.
And oh wow.
Yeah.
I'm surprised you haven't choked on it or inhaled it because it's so loose in your mouth.
To push it
You just push it
all
in.
the time. And don't eat.
Right.
Because you eat in the morning, don't you? That's what you were saying.
Wow.
That's it. Well, that's the last time you do that, darling.
Wow. It's pretty. Wow.
Yeah.
So you would physically have to remove yourself for an hour or two
Yeah.
to get it all.
To make myself presentable, yeah.
Did you tell anyone? Did anyone know your ritual?
No, my husband, but no one else. My parents I eventually spoke to about it, but no, not many people. Because it's embarrassing and already anxiety enough just to have that in your household, let alone let anyone else know about it. It's extreme anxiety and embarrassment.
It's gone now.
Yeah, definitely gone.
Out the window.
Yeah,
It's amazing.
yeah.
So what will you do?
Assistant accountant. So yeah,
So you deal with people? And
deal with people and in meetings and obviously do long hours and so it's hard to manage. Yeah.
How easy is it now?
Oh, fabulous! I'm loving it. I'm loving it. Even just things like I've organised a couple morning teas now because I'm confident to socialise with people. And
Conferences.
yeah, this is good.
thank you very much
Thank
for
you.
coming and doing this. I really appreciate it. I really appreciate it.
Thank you.
Yeah, no, it's great.
Yeah, it's just
And it's so candid, and it's
and just thank you for the opportunity
The honesty.
because it's it just changes your life and changes our lives.
All right, thank you.
To see you like this is just
very proud.
I owe you guys big time. Thank you very much. Thank you.